Hello, everyone. I'm Hartford Healthcare's Tina Verona. Thank you so much for joining us for this live Facebook discussion. I am here alongside Dr. Brian Wong. He's a neurologist specializing in neuroimmunology for patients with multiple sclerosis. Dr. Wong, thank you for being here with us today. We really appreciate it.
Thank you for having me.
Well, first, before we get into this new program that we offer here at Hartford Healthcare, let's start with the basics. Let's talk about what is multiple sclerosis right off the bat.
So multiple sclerosis is an autoimmune condition where the immune system is overactive and unfortunately attacks the nervous system, the brain and the spinal cord most commonly. And as a result, patients experience a variety of different symptoms. They may experience episodes where they have focal numbness or weakness, or have an episode where one eye becomes blurry or painful. And over time, those kinds of symptoms can persist, and a patient may be left with some disability as a result.
Now, multiple sclerosis is a neurological condition. There are many other neurological conditions like Lyme disease. There are so many, making multiple sclerosis difficult to diagnose. How do you diagnose MS?
So it's we use both clinical symptoms, a patient's history of some of the symptoms they've experienced in the past, as well as some of the tools like MRI imaging or lumbar punctures, where we collect fluid from around the brain and spinal cord and test that fluid for different proteins. And based on both symptoms and MRI imaging and those tests, we can diagnose a patient with the condition.
And it is tricky because sometimes these symptoms can present as Lyme disease or another neurological condition, correct?
That's correct. A lot of the symptoms in multiple sclerosis can sometimes be nonspecific or similar to other conditions. Numbness can happen for a variety of reasons, and not all of them are due to neurologic conditions like multiple sclerosis.
Now, explain for the audience, you are a neurologist specializing in neuroimmunology. This is a highly focused, highly specialized area of neurological conditions. What is neuroimmunology for the folks out there?
So neuroimmunology is a subspecialty within neurology which really focuses on the immune system's role in contributing to neurologic diseases. It focuses on most commonly conditions like multiple sclerosis, but also other conditions that are less common as well.
And this can help patients because this is so highly specialized, right? And it needs to be. MS needs to be that highly focused area.
Yeah, although multiple sclerosis is a relatively common condition, the treatment has developed and advanced over the recent years, and so some of the newer treatments and the newer options for treatment aren't something that the general neurologist may feel as comfortable with dealing with as specialists such as myself.
And we are happy to have you. You joined Hartford Healthcare back in September to launch this specialized program at the Ayer Neuroscience Institute, part of Hartford Healthcare. Tell us about this program and what you're going to be offering.
So we are hoping to offer patients with multiple sclerosis and other autoimmune conditions in the neurologic field basically cutting-edge treatments, up-to-date treatments with newer, stronger therapies that are available, as well as provide comprehensive care for other symptoms that are outside of the realm of neurology. For patients, for instance, with multiple sclerosis, they may need things like physical therapy, urologic support, and so some of the benefits of being in the Hartford healthcare system is that we have all those resources available to us. It's a large system, and we have a lot of providers that can all contribute to comprehensive care for patients with these conditions.
Right, so while you're focusing on MS, you specifically, and the other providers in the practice, while you're focusing on that, they may need other types of therapies, like you said, rehab, so having access to that system-wide approach is so vital. We are getting some questions on Facebook. Brooke from Facebook wants to know, if you're diagnosed young, can you still have children? Thanks for that question, Brooke. That's
a great question, Brooke. So a lot of times patients who are diagnosed with multiple sclerosis are diagnosed in their younger years of life. So it's not uncommon for people to be diagnosed in their 20s and 30s. But, and that's typically when people have children. People with these conditions can still have children. It's sometimes the difficulties related to pregnancy and medical conditions is the medications that we put people on. But even with those obstacles, patients with MS and other conditions can still have children.
What are you seeing typically in terms of who is being diagnosed? Are we seeing, is it more men, is it more women, is it different age groups? What are we seeing now? What's sort of the trend now that we're seeing in MS diagnosis?
So that's a great question. You know, more commonly in autoimmune conditions, younger people tend to be affected more commonly than people who are older in age, and also women tend to be more affected than men in general.
Mm-hmm. If you have a neurological condition, can it lead to MS anywhere down the road if you do have conditions like that, neurological conditions?
So one neurologic condition doesn't necessarily predispose you to developing multiple sclerosis, but some people with other autoimmune conditions may be a little bit more prone to developing other autoimmune conditions.
Right.
So people, yeah. So for instance, people with thyroid problems as a result of autoimmune conditions may be more likely to develop other autoimmune conditions such as multiple sclerosis.
Really, that's an interesting fact. I don't think many people realize that. So if you do have those conditions, should you be, what should you be doing?
There's nothing really that I would suggest for a person to prevent multiple sclerosis in terms of risk factors. However, there are a few things that we know that are associated with development of the condition. For instance, there may be some association with smoking. There may be a small association with obesity as well. So in general, if patients maintain a healthy weight and avoid smoking, maybe that could be something that slightly reduces their risk. But unfortunately, we don't know 100% the cause of multiple sclerosis, and so preventing it is somewhat tricky before it is diagnosed.
Or just be on the lookout for those symptoms. Like if you do have a thyroid condition or something other than that, be cognizant of conditions that there are symptoms that could be MS.
Certainly, I think everyone should be aware that these conditions are relatively common, and multiple sclerosis affects maybe 0.1% of the general population. So it's not uncommon for people to have people in their family or know someone that has these conditions, and just knowing what the symptoms are is useful.
Sure. Jane Lee has a question. Are more women prone to this than men?
Jane, that's a great question. More women are more likely to develop multiple sclerosis than men. We know that autoimmune conditions in general typically affect women more than men, and MS is basically falls into that category.
Mackenzie wants to know, what are the different types of MS? Thanks, Mackenzie.
Yep. Thanks, Mackenzie. There are really probably 3 categories that we place patients into when they're diagnosed with multiple sclerosis. There are 2 that people are diagnosed at the start, and 1 that sometimes can develop later. The 2 types that people are diagnosed with initially are relapsing remitting multiple sclerosis, where a patient will have episodes of acute worsening and then sometimes recover, and then they may have a period where they have no symptoms, and then maybe another episode where they have acute worsening again, things like focal numbness or focal weakness, and then get better. That's probably the more common type of multiple sclerosis. Also, there is a type called primary progressive multiple sclerosis, where instead of episodes of acute worsening, patients instead have slow changes in symptoms over time. So a patient, for instance, may notice that they're having difficulty walking, and slowly over time that may progress over the years. And then once a patient is diagnosed with relapsing multiple sclerosis, sometimes as they age, that can transition into something called secondary progressive MS, where they no longer have relapses and instead have that progressive symptoms over time as well.
And Dr. Wong, I think that just really sort of underscores the importance of having this specialized program, because there are so many different facets to MS that have to be all treated differently, correct?
Yeah, that's absolutely right. And the difficulty is making sure that you're making the correct diagnosis and the type of multiple sclerosis that a patient may have, because the treatments for each type is a little bit different.
We have a question now from Casey on Facebook. She asks, how can I help someone who was recently diagnosed? That's a really great question.
Yeah.
Thanks for that, Casey.
That's something we hear a lot, Casey,
Yeah.
so thank you for your question. One thing I would say is just, whether this is someone that you know in your family or a friend, just providing them with just overall support, because sometimes a new diagnosis for a patient is very difficult. It's sometimes, someone may have plans for for what their future may look like, and when someone is diagnosed with a new medical condition, sometimes that changes slightly, and so whatever you can do to be supportive of them in general is helpful.
And you always say when you just recently diagnose a patient with MS, they always want to know, what lies ahead, but it's almost difficult to sort of chart that path, right?
That's true. We don't necessarily have a great way of telling what the future looks for one specific patient. In the past, some people have had significant disability as a result of the condition, but our hope is now with these new treatments that we have that we're going to see people who are less affected by the condition.
And sort of can keep it at bay too. There's something like 15 new medications that you can tap into to confront multiple sclerosis and treat it. We've come a long way in the treatment, would you say? That's
absolutely true. We're constantly seeing new developments in the field, and there are new medications coming out. Very recently, several medications have come out that have improved patients' outcomes long term.
What are we talking about in terms of medications? Like you have a whole arsenal that you can refer to in terms of these 50 new medications. What do they all do in terms of the different forms of MS that are out there? How can you treat people nowadays?
So a lot of times when a patient, say, is newly diagnosed with multiple sclerosis, what may happen is they may put them on what we call disease-modifying therapy, or a medication to calm the immune system down. The goals of that therapy are, 1, to prevent those episodes of acute worsening or relapses, 2, to prevent changes on their MRI imaging, which sometimes may be asymptomatic for a patient, and 3, long-term, to prevent long-term disability. And so those medications can come in a variety of different forms. They can be injected by the patient themselves. They may be pills, and sometimes they're infusions, which they receive in an infusion center in the hospital or in a clinic.
In case you are just joining us, we are talking with Dr. Brian Wong. He is a neurologist at the Ayer Neuroscience Institute, specializing in neuroimmunology, specifically for MS. Dr. Wong, we have another question from Laura on Facebook. If you have an immediate family member with MS, are you likely to get it as well? Thanks, Laura.
So that's a great question, Laura. We get asked that all the time. Just so you know, multiple sclerosis is not a genetic disease that we think of as other genetic diseases. It may be that if you have a first-degree family member with multiple sclerosis, you may be at a slightly increased risk of developing the condition, but it's certainly not a genetic condition. That risk is probably around 3% or so for a first-degree relative, so there would probably be a 97% chance that you would be unlikely to develop the condition.
A lot of activity in our Facebook page. We love to see all of these fantastic questions coming in. We have another one from Sonia. Is it possible to restore the myelin sheath?
So, Sonia, yeah, there's a lot of research going on in the field of MS, and some of the research is focusing on recovering that myelin sheath, which covers the nerves, which, as you know, is the problem in multiple sclerosis. And in MS, that myelin sheath is injured by the immune system, and people are looking at the possibility of recovering that. Right now, the therapies that we use aren't really targeted at that specific issue in the immune system, but that may be something that we'll see more regularly in the future.
Very interesting. Laura from Facebook asks, I read somewhere that a virus could possibly trigger this. Is MS contagious?
That's a great question. MS is maybe not an infectious disease like things like Lyme disease or the flu, but we do know that there seems to be maybe a predisposition in developing MS for patients who have been infected with the Epstein-Barr virus, the same virus that causes a mono kind of presentation in younger people. So people who have been infected with that virus may be at a slightly increased risk of developing MS, but it isn't an infectious disease. We just know that the immune system may, in fact, be overactive and incorrectly interpret attacking that virus and attack the patient's own brain and spinal cord as a result of that infection, but it's not causative.
I want to talk about something that I find certainly fascinating, and I'm sure maybe a lot of folks out there watching us may not have heard about, but the correlation between a lack of vitamin D exposure to MS. There is a correlation there. Can you explain that?
So we do know that people who live further away from the equator may be a little bit more likely to develop the condition than people who live at places closer to the equator. We live in New England here, and so during the winter months we don't get as much sunlight, and as a result we may be at risk for vitamin D deficiency during those months. And people who have a vitamin D deficiency may be more likely to develop MS, particularly if they have a vitamin D deficiency during their younger years in life, so perhaps up until their early teens.
Do we know what the correlation between vitamin D and MS is, how that comes together?
So vitamin D does help a lot of things, including bone health, but also seems to have a role in regulating the immune system. And so having a healthy level of vitamin D is beneficial in making sure that the immune system behaves correctly.
And that healthy level, is it 2,000 IUs daily?
So that might be a supplement dose that we may recommend for patients with MS. The lab values, if you were to have your blood checked, do vary from each lab, but generally over a cutoff value of 30 in the lab sometimes is what would be considered normal.
And we see this more common in women with vitamin D deficiencies than we do men, it seems like.
You know, we see it both in both men and women. I would say that for people who are, who have jobs that work indoors and are not in outdoor, engaging in outdoor activities on a regular basis, it's very easy to get vitamin D deficient, particularly in the winter months.
Sure, absolutely. I just find that so fascinating. Who would think vitamin D, the correlation, but with the immune system, it makes sense. Sandy on Facebook asks, a friend of mine is showing symptoms that closely match what you've described. What's the best way to go about talking to them? Sandy, thank you, and thank you for your concern about your friend there.
Yeah, thank you, Sandy. A lot of symptoms can mimic MS, as we talked about, so it's difficult to make a diagnosis sometimes from afar, but things maybe that would be red flags for developing multiple sclerosis would be things like focal numbness or focal weakness that occurred all of a sudden in a friend of yours, and then over the course of weeks or so got better, maybe not all the way, and sometimes all the way. For a patient that experiences those kind of symptoms, I think it'd be reasonable for them to be evaluated by a neurologist, perhaps a specialist like myself, but at least see a medical professional that could further kind of delve into what they've been experiencing. Yeah,
absolutely. Thanks for that question. We talked a little bit about the difficulty in terms of diagnosing MS and how tricky it can be. It can mean a number of things. Joanne asks, do doctors ever mistake MS for mercury poisoning?
Thanks, Joanne. Heavy metal poisoning, things like mercury, can cause a lot of variety of symptoms. I would say that's probably not a very common, condition that we mistake for MS, just because multiple sclerosis has other findings, for instance, MRI findings on imaging of the brain or the spinal cord. That may not be something that you would expect to see in something like mercury poisoning.
Right, right. Rondasia asks, what does an MS diagnosis mean for someone's life disability, life expectancy, etc.? Thanks, Rondasia.
Yeah, thanks, Rondasia. It's sometimes very difficult to predict, and our goals are, at least for disability, to minimize the disability that patients experience. That we do through the variety of medications that we prescribe for patients with multiple sclerosis, and hopefully our goal is to make it so that the condition has a minimal effect on their life as much as possible. Regarding life expectancy, it may be that patients with multiple sclerosis have a slightly lowered life expectancy than the general population. It's perhaps around 7 years, but maybe that may be changing as we are able to treat patients more effectively.
We are, of course, talking with Dr. Brian Wong. He is a neurologist at the Ayer Neuroscience Institute, part of the Hartford healthcare system, specializing in neuroimmunology. We're specifically talking about multiple sclerosis and this new program that you kicked off. Very exciting for you, obviously, to be able to offer patients so much more than you could years ago. This is a good time for MS in terms of treatment and getting patients exactly what they need to live more of a normal lifestyle going forward. Talk to us about, once somebody does come in to this program, they're diagnosed with MS, what happens from there?
So if a patient comes to me with a new diagnosis of multiple sclerosis, what I'll do is, first, discuss the diagnosis and what multiple sclerosis is, and then from there we'll talk about different treatments what are available. No one treatment works for every particular patient, so choosing the right medication for the right patient is important, and also making sure they have you know, the ability to tap into some of the other resources in our healthcare system, things like being able to go to physical therapists that are near their home to help them, you know, walk more effectively, or see a urologist if they're having urinary symptoms.
Right. We have another question, a very specific question from NB on Facebook. Asks, are there any connections to ALS and MS? I was diagnosed at 23 with RRMS, and my dad died when he was 54 of ALS. Is this a genetic thing? Thank you for that question.
So we're still learning a lot about both of those conditions, both relapsing remitting MS as well as ALS. It is not a common thing for patients with relapsing remitting MS to also develop ALS. And so even though your family member was diagnosed with that condition, I wouldn't necessarily expect you to develop that condition as well.
Another question from Mackenzie asks, what is the average age of diagnosis? What do you see?
The average age of diagnosis varies between the type of multiple sclerosis, but in general, most patients are diagnosed in their 20s and 30s. Sometimes we do diagnose patients later, but usually the symptoms that they've had, if they were to think back in the past, started in their 20s and 30s.
And has that changed? Has that age changed over the years? Has it gotten younger, have you seen?
You know, there are some young people, even children, that sometimes are diagnosed with conditions like multiple sclerosis, but that's less common. Typically, like other autoimmune conditions, the 20s and 30s are really the peak for when people are diagnosed.
When they're diagnosed. Now, you say they could start earlier. What are, and maybe have missed the symptoms? Maybe it could just be something so that you think is so benign that you just don't even really make that correlation. What are some of those things that you could be missing that starts off in a very subtle way?
Yeah. You know, sometimes the symptoms can be subtle and sometimes they're not so subtle. I've had patients come to me that were eventually diagnosed with multiple sclerosis that had episodes in the past that they maybe attributed to other things. For instance, one patient may have had an episode of optic neuritis where the optic nerve in the eye becomes inflamed, and they had blurry vision with discomfort for maybe a week or two on end, and that improved over time. They may have thought that was maybe an eye problem rather than a neurologic problem, and sometimes those can be missed if not kind of evaluated with certain things like imaging or other exam findings.
Interesting. So that's something like, yeah, if you have something and it goes away, you think, okay, it just went away, maybe it was just a virus, but it could mean something more. So interesting to keep your eye on those things. Casey asks, what is the most common form of treatment? Thanks, Casey.
So Casey, that's a great question. As far as the most common form of treatment, you know, I would probably, you know, what I would say is there are several different types of treatments. There are, again, self-injectables, which a patient may give themselves. There are oral pills, and there are infusions, which people receive in the clinic. There's no best medication, and so, you know, just because something may be used more commonly doesn't make it the right medication for the right patient. So with each person, I kind of try to tailor the medication to what they're experiencing.
I love all of these great questions. I'm so happy to see so many people are taking part in this. It's so important. We have another question. Are there any other parts of the country experiencing a higher than normal rate of new MS cases? Can you share any insights in that?
That's a great question. You know, similarly what we were talking about before with the vitamin D deficiency, it may be that places that are farther from the equator that have maybe 4 seasons and have winters without a lot of sunlight, that people may be more likely to experience conditions like multiple sclerosis.
You know, you always hear, you know, sunlight causes, you know, melanoma and skin cancer. You can't have too much, so, you know, we tend to cover up because of that. But how much is a safe dose, just being outside and getting sunlight, how much is a safe dose to get a vitamin D the natural way?
Yeah, I'd say, you know, as long as you're engaging in regular kind of activity outdoors and maybe not, you know, sunbathing every day, that should be okay. Obviously, you should take the regular precautions you would do with sun exposure, using things like suntan lotion to avoid skin cancers sunscreen, excuse me, to avoid the risk of developing things like skin cancer. But you know, as long as you're engaging in regular outdoor activity, that probably is sufficient.
Would be sufficient. Yeah. Another question, a family member was recently diagnosed with MS. Will he be able to drive, or should we start having these tough conversations now?
You know, that's a really great question. I would say there's no kind of one answer to that question for each person. It's a little bit individualized. We do have patients who develop multiple sclerosis who have minimal disability and can continue to drive throughout their life, but other patients who have symptoms which limit their ability to drive, for instance, maybe their vision is affected or their hand dexterity is affected. For those patients, we may have them evaluated to make sure that they are still safe to drive. So it really depends on each person.
I'm sure you hear this a lot, but paralysis always probably comes up, especially with a new diagnosis. People often want to know, am I going to be wheelchair bound? How long is that going to take before I am? But with these new medications, is that offering new promise and new hope for to sort of curtail that?
Yeah, I think we're absolutely seeing patients do much better than they were in years past. Mm-hmm. We have medications that prevent particularly those episodes of acute worsening or relapses. And for instance, patients may experience relapses where they have inflammation of the spinal cord, and when that happens, they can have difficulty walking or even paralysis below, say below their waist or another level. When that happens, sometimes they may recover completely and sometimes they don't recover completely. But by using these medications to prevent those events in the first place, patients tend to do better.
Oh, that's great. Who would be a good typical candidate for this type of neuroimmunology treatment that you are offering at the Ayer Neuroscience Institute?
So I would say anyone that is diagnosed with conditions that we talked about, things like multiple sclerosis or other conditions within neuromyelitis, things like neuromyelitis optica or neurosarcoidosis, those would be candidates that would be a good person to come see us in the clinic. If your doctor suspects some of these conditions, we'd be happy to see you, and we could evaluate there.
Now, those are less common conditions, but how uncommon are they, and what exactly are those conditions?
They're much less common than things like multiple sclerosis, and really they appear on a case-by-case basis. They require different treatments than multiple sclerosis, and so each condition is kind of managed individually.
And explain just what are those conditions?
So neuromyelitis optica, for instance, is a condition similar to multiple sclerosis where patients have the immune system attack the spinal cord, the optic nerves of their eyes, and sometimes the brain as well. But with those patients, they are more likely to have severe relapses of inflammation of the spinal cord, and for those patients, we treat them with different medications. Yeah.
Dr. Wong, we have another question from Laura. She asks, are there alternate therapies that are recommended to enhance recommended medical treatment? Thanks, Laura.
So for alternative therapies, Laura, thank you for that question. I'm perhaps not 100% certain what you're referring to, but what I would say is, as far as aside from the general medical treatment that we use to treat multiple sclerosis, we can prescribe other medications for symptoms related to MS, things like urinary symptoms or pain related to the condition. And so we don't use just one medication to treat MS. Sometimes we use a variety of medications or other treatments to treat the symptoms as well.
We talked about all these 50 new medications that are basically at your fingertips that you can use. And we've come so far in the treatment of MS. What lies ahead? What's next? What are we seeing coming down the pike in terms of MS that is offering new hope for patients out there?
Yeah, so I think it's a really exciting time. I think we're going to continue to see new medications that are as effective as some of the current ones, or even more effective, hopefully. We'll also hopefully be able to use other tools to making sure that we're treating each individual patient with the correct medication, and also treating and hopefully diagnosing them sooner, where we have the benefit of using those medications early on to prevent disability long term.
Yeah, because patients now, and I think that there is that hope out there, is that they can have MS and they can live these active lifestyles that maybe years ago probably could not do.
Yes,
right?
Yeah, that's absolutely what we're hoping. We want these conditions to have a minimal effect on patients' lives, and hopefully they can continue to have active lives and enjoy the things that they enjoy doing without being hindered by their medical conditions.
Dr. Wong, how excited are you to have this program, to be able to, and you're in Southington, But how exciting is this for you to get to this point, to be able to offer this program, this very highly specialized program for the people of Connecticut and beyond? It's got to be a pretty good feeling for you to be able to offer this.
Yeah, we're all very excited. We're really happy to be able to offer these kinds of treatments and services to people in the area. We're really hoping that patients will be able to really have great outcomes as a result of the treatments that we're able to offer.
Yeah, absolutely. We have a question from Jennifer. She asks your thoughts on stem cells. I'm sure you get this question all the time. Thanks, Jennifer.
That's a great question, Jennifer. We are seeing some encouraging results from stem cell transplants, but with that said, a lot of the data is very preliminary, and the stem cell treatments are really only offered in the research setting. And so while the data is encouraging, I think we are a little bit off from the time when we can use that as a regular treatment for our everyday patient.
What do you want to say to the folks out there watching who either may have MS, or we've actually gotten a lot of questions from people concerned about others who may have MS, how to broach the topic with them, or what to do next? What do you kind of want to say to the audience watching now in terms of multiple sclerosis?
I would, what I'd like to say is that, it's a relatively common condition, and so you may know a person with these conditions, or that may be a family member or a friend. If, say, they are experiencing symptoms, it may be useful to have them see a medical professional and be evaluated for these conditions to make sure that we're able to best manage the condition if we do diagnose them ultimately with things like multiple sclerosis.
And to have someone like yourself who specializes in this is so important in terms of treatment, because you can diagnose them the way that they need to be diagnosed, but you also know what you're looking for, correct? And I think that's important to mention too, is that because it can be a tricky diagnosis, you really have to have that highly specialized, trained, skilled set to do so,
yes,
right?
Yeah, absolutely. There are a lot of other conditions which can look very similar to multiple sclerosis, and so coming to us here at Hartford Healthcare may be beneficial for patients who may have similar conditions which may mimic things like MS.
Dr. Brian Wong, thank you so much. We have really gotten some excellent, excellent questions today, and we, of course, thank you for your insight as always. We appreciate it. And of course, if you would like more information, you can call 1-855-HHC-HERE. Once again, thanks for all the terrific questions and for watching. I'm Hartford Healthcare's Tina Verona. We'll see you next time.